A special thank you to each of our subscribers who make this channel possible. Here's today's story. In a significant political development, House Republicans have unveiled a controversial centerpiece of President Donald Trump's proposed legislation, dubbed the Big, Beautiful Bill. This legislation, revealed late Sunday, proposes at least $880 billion in cuts primarily to Medicaid, aiming to offset the cost of $4.5 trillion in tax breaks. The sweeping proposal, which spans hundreds of pages, is igniting a fierce political battle over health care, reminiscent of the GOP's failed attempts to repeal and replace the Affordable Care Act, known as Obamacare. During Trump's first term in 2017, Republicans argue that these cuts are necessary to eliminate waste, fraud, and abuse in the healthcare system. They are introducing new work and eligibility requirements for Medicaid, which they claim will generate savings. However, Democrats are sounding the alarm, warning that millions of Americans could lose their health coverage as a result of these cuts. A preliminary estimate from the Nonpartisan Congressional Budget Office, CBO, suggests that the proposals could reduce the number of insured individuals by approximately 8.6 million over the next decade. Representative Brett Guthrie of Kentucky, the GOP chairman of the Energy and Commerce Committee, emphasized the potential benefits of the bill, stating, "Savings like these allow us to use this bill to renew the Trump tax cuts and keep Republicans' promise to hardworking middle-class families." On the other hand, Democrats are denouncing the cuts as shameful, arguing that they represent yet another attempt to dismantle Obamacare. Representative Frank Pallone, the top Democrat on the committee, stated, in no uncertain terms, millions of Americans will lose their health care coverage. Hospitals will close, seniors will not be able to access the care they need, and premiums will rise for millions of people if this bill passes. With House Speaker Mike Johnson's self-imposed Memorial Day deadline looming, Republicans are racing to pass this comprehensive package of tax breaks and spending cuts. They are planning to hold round-the-clock public hearings this week to discuss various sections of the bill before finalizing it into a massive legislative package. However, the political landscape remains uncertain, with more than a dozen House Republicans expressing their opposition to cuts in healthcare safety net programs that their constituents rely on. Notably, Trump has distanced himself from the drastic cuts, assuring that there will be no reductions to Medicaid. The ambitious plan involves input from 11 House committees, all tasked with compiling their sections to achieve at least $1.5 trillion in savings, which will help fund the continuation of the 2017 tax cuts that are set to expire at the end of the year. The Energy and Commerce Committee has been under particular scrutiny, as it was assigned the goal of generating $880 billion in savings. The committee achieved this target mainly through proposed healthcare cuts and by rolling back green energy initiatives established during President Biden's tenure. The CBO's preliminary analysis indicates that the committee's proposals could reduce the federal deficit by $912 billion over the next decade, with at least $715 billion of that coming from health-related provisions. Central to the proposed savings are significant changes to Medicaid, which currently provides nearly free health care to over 70 million Americans. The legislation introduces new community engagement requirements, mandating able-bodied adults without dependents to engage in at least 80 hours per month of work, education, or community service to qualify for Medicaid. Additionally, beneficiaries would be required to verify their eligibility twice a year instead of once, potentially complicating access to the program for many. While Republicans contend these measures will ensure that Medicaid is administered fairly, critics argue that they will create barriers for individuals trying to maintain their coverage. Many states have expanded their Medicaid programs due to federal incentives, but the new legislation seeks to cut a 5% increase in funding that was established during the COVID-19 pandemic. Furthermore, it prohibits federal funding to states for immigrants who cannot prove their citizenship and freezes a provider tax that some states utilize to fund their Medicaid programs, which critics argue is a loophole that encourages system abuse. On the energy front, the proposed legislation includes fewer provisions but aims to roll back climate change strategies enacted by President Biden in the Inflation Reduction Act. It seeks to rescind funding for various energy loans and investment programs while expediting permitting processes for natural gas development and oil pipelines. As the deadline approaches, the political implications of this legislation are vast, with both parties gearing up for a contentious debate over its potential impact on healthcare and tax policy in the United States. The outcome of this legislative effort will undoubtedly shape the political landscape as the nation heads toward the next election cycle. That's all for this story. We upload videos every day covering many different subjects, so hit that subscribe button to stay informed. Thanks for watching.